Hello friends. So if you are on a weight loss journey or if you are suffering from a little bit of fat in any part of your body and are looking for body contouring or weight loss treatments, this video is for you. In this video, I'll explain according to your weight and height which is the best treatment for you. Everybody is confused these days that what is the best treatment? Is it diet and exercise? Should they go with something called as M-Sculpt or should they go with HIFU? Is cryo a good option or one should choose liposuction? Then there is bariatric surgery, and now there is another option of taking drugs or medicines which can help in weight loss, which you must have heard by the name of Ozempic, Mounjaro, Wegovy, etc., which are all GLP-1 agonist drugs. So guys, today I'll explain in detail about all these things and what is the best option for your weight and height. Hello friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I work at Panache Aesthetics, Pitampura in Delhi. And these days I get a lot of queries regarding what exactly is Wegovy or Mounjaro or Ozempic, and then there is a lot of confusion regarding how much will cryo work, is HIFU a good treatment or not. So you need to know what is your BMI. Now to calculate your BMI, you need to know your height in meters and your weight. So to calculate your BMI, you should know your weight in kilograms and your height in meter. So what you do is you put in that formula, your weight divided by your height squared. So once you do that, you will get a value. So now once you get this value, you can now know that what is the category in which you fall. So if you are less than 18.5, you are underweight, and in that case I would recommend you can go with treatments or good nutrition or good diet plans so that you can increase your weight, increase your muscle mass. Increasing weight is not just increasing your fat, even your muscles and bones contribute to your weight. So you are underweight and you need to have a proper good supplemental diet, a good nutrition to increase your weight overall and to come into the normal range. Now the normal range is 18.5 to 25, which is considered a healthy range. Now it doesn't mean that anybody who is less than 18.5 or more than 25 is unhealthy. The thing is, this is the range in which most of the individuals are considered to be really healthy. You fall in this category and you suffer from a little bit of extra fat, maybe in your lower tummy, maybe on the love handles, or maybe you have some uneven fat accumulation on your chest or on your saddlebags. Then in those cases, I would recommend you can go with cryotherapy. Now, if you are in the category from 18.5 to 25, there are three different things that can really work for you. If you are looking for building up your muscles, then devices like M-Sculpt, which stimulate your muscles, will help you. What they do is they tone up your muscles. So if you are putting M-Sculpt on your tummy area, they will actually cause flexion, that is contractions of your rectus muscles, and give you a better shape, better six-pack abs. If you put it on your butt area, it can cause contraction of your glutes and then give you a better shape on the glute area. So it is actually increasing your muscles. It is not actually decreasing the fat. So anything which is stimulating your muscles, something like M-Sculpt, will increase the muscle mass. It is not exactly to decrease the fat. Now, if you want to actually reduce the fat and if you fall in the category from 18.5 to maybe 22, you can go with cryo. Now what cryo does is, cryo can melt your fat by freezing your fat. So what happens is, if you have a very slight double chin, if you have a very small love handle and you are not obese, you are in a normal weight range, only then cryo will help you. You will apply that handle for 45 minutes, you will need multiple sittings and the fat will be frozen and then gradually it will be taken off by the body. You have to make sure that you use a very good cryo machine, because if you do not freeze it properly, either your skin will get damaged or fat will not freeze properly, and it can cause paradoxical increase or growth in your fat. Now, if you are on the higher end of the normal fat range, that is from 22 to 25, and if you have a significant fat bulge in a particular area, maybe on your love handles, maybe saddlebags, maybe chest, causing gynecomastia, or maybe a bigger double chin, then I would suggest go with liposuction. Liposuction can take out the fat permanently from a particular area and make your body come into shape. If you see this lady, she had a normal BMI, but her body shape was not normal or not according to what she exactly wanted. She wanted a much thinner torso and wanted a bigger butt. That is, she wanted an hourglass shape. So what we did for her was that we took out fat from her tummy, from her sides, from her back, and we filled up that fat in the buttock area to give her a more hourglass shape. So with a normal BMI for her, we did a liposuction with fat grafting. Now, liposuction can be done for anybody from 25 to 30. So the best, if you are from 25 to 30, you are considered overweight. In this category, diet and exercise along with liposuction is the best treatment for you. So if you have a particular pocket of fat, liposuction. If you want to reduce the fat overall in your body, diet and exercise is always the best option. So diet and exercise you have to do. It doesn't matter what treatment you are opting for. No matter if you are underweight, no matter if you are obese category 3. Diet and exercise, there is no supplement to that. You can always add other things. There is no alternative to diet and supplements. You can always supplement it with other procedures, but there is no alternative to diet and exercise. Now, what if you are from 30 to 35, which is considered as obese category 1? So in this category, we can do liposuction, which can be a debulking liposuction, in which if you are worried that you have a very big tummy, we can take out fat from all around your tummy, sides and back. Plus, you always have to make sure that you will diet and exercise to maintain a very good healthy lifestyle. If you are above 35, you can always go with the drugs like GLP-1 agonist, which are the glucagon-like peptides. In this category, you will have these drugs like Mounjaro, Wegovy, or Ozempic, or tirzepatide and other things. Now, they are in forms of tablets as well as in the form of injectables, and consult a physician or an endocrinologist to advise you as to how you should take these medicines. You are not supposed to take them on your own. You are not supposed to take them on prescription by an esthetician. You have to see an MD medicine or a DM endocrinologist doctor who should examine you properly, take all your parameters, and then advise you the drugs as per your need. Now, if you are in a category which is more than 40, then you can either choose from bariatric surgery or from drugs like GLP-1 agonist. Always remember, diet and exercise you have to do. There is no alternative to it. I hope this video was of some help to you. It will help you choose between what is the best treatment for you. If you have loose skin, in that case, you have to trim the skin or cut the skin. For instance, if post-pregnancy you have loose skin on your tummy, you have to go with a surgery like tummy tuck. If you have loose skin post-weight loss on your arms, you have to go with arm lift. There is no alternative to it. Hope this video was helpful to you. If you have any more questions regarding these, feel free to call us. Thank you and have a nice day.